If you're worried about prolapse during your pregnancy or your postpartum, we're going to walk you through a workout to help relieve symptoms of prolapse, in addition to help you learn how to move so that we can be in those upright positions while also managing any symptoms you may be experiencing from prolapse. Welcome to the MamasteFit YouTube channel. My name is Gina. I'm a perinatal fitness trainer and birth doula and currently pregnant with baby number 4. And I personally have a grade 1 prolapse of my bladder that comes a little bit down into the vaginal canal. And Roxanne, who's going to be featured in the video, also has a prolapse as well. And so prolapse can be a very normal part of giving birth, of having children, but it doesn't mean that the symptoms you experience from prolapse are mandatory or you have to experience them. I would almost describe prolapse as having looser skin after giving birth. Our bodies are just a little bit different after we have a baby. It doesn't mean that it has decrease in function though. So with this workout, we're going to walk you through a series of movements to help relieve any symptoms that you may be feeling from a prolapse, in addition to help you understand how to breathe and to move in these more upright positions so you can return to workouts and a more active lifestyle. If you want more workouts to help support you during your pregnancy and your postpartum that are prolapse-friendly, join our online prenatal and postpartum fitness programs. Both of our fitness programs incorporate an education course to teach you how to move, because it's not just the movements that you do, but rather how you do them that can help to support symptoms that you may be feeling and to support your pelvic floor and core health. With our online fitness programs, we offer them in 2 main formats. One is going to be our app-based format, which is going to be a list of exercise with short demo videos. This is a great option for somebody that prefers to work out at their own pace. But if you prefer to follow a video as you work out at the same time, we do offer on-demand programs both for pregnancy and for the postpartum, which is a full-length workout video similar to this that you work out with and follow at the same time. You can check out all of our fitness programs on our website at MamasteFit.com and use code YouTube10 to get 10% off any of our online programs, and there's options to bundle them with additional education courses as well. For this workout, we're going to start with about 5 minutes of breathing drills to help release some tension within the pelvic floor and to adjust our postural position to help support any symptoms that you may be feeling with prolapse. Then we're going to move through 3 rounds of exercises where I'm really cueing you through different movements to help release tension, to strengthen, and then to also really think about our breathing to help support any symptoms of prolapse I may be feeling. And then we're going to finish up with a few minutes of mobility at the end. For this workout, the equipment that you'll need some sort of pillow to elevate the hips for our breathing drills. You'll need a yoga block as well. If you don't have a yoga block, a stack of books can be a great option. For the workout, we're going to need an elevated surface like a bench or a chair. You can also use a Pilates ball or something soft between your legs, or you can also hold some weight as well if you would like for the box squats. In addition, you're going to need a weight for some lateral hip shifts and then a band attached around eye level or over the top of your door frame for some archer rows that we're going to finish up with each round. All the mobility work at the end will be body weight, so there's no equipment required for that. Once you've got your equipment, let's go and get started with today's workout. So we're going to start our warm-up with this hips elevated breathing drill. So you'll place your pillow or your slightly elevated surface underneath your hips, and you're going to roll up into this little ball. If you are pregnant and your belly is in the way, you can also just elevate your feet up the wall, or you can just spread your legs a little bit wider. And so we're going to breathe here for 1 minute, really focusing on finding a rounding in the low back. And this hip elevated position is going to help to take some anti-gravity off of the pelvic floor to allow it to release and to relax. And so I want you to think about big inhale into your rib cage, into the back that's pressing against the floor. So you're trying to inhale as much as you can down into the floor. When you inhale, you may feel a little bit of like stretching or expansion down in the pelvic floor perineum area, or you may not, and that's okay. So we're inhaling down into the floor, and then exhale to gently lift up in the pelvic floor, particularly towards the front half. So we're inhaling down into the floor into our back, and then exhale, think pull belly to spine. When you pull that belly to spine, we're going to find a little bit more of a rounding as rib cage and pelvis pulls a little bit closer together. So continue breathing here. Now go ahead and roll to the side, and we're going to grab our yoga block to do an all fours hip shifted breathing drill. And so with this, you're going to place the yoga block underneath one knee, and then you're going to shift your weight towards that elevated knee. And so you should feel a little bit more of a stretch in this elevated hip right here, kind of in that back hip pocket. And then I want you to push your belly away from the floor. So we're finding this rounding in the back. So big inhale again into the back. And then exhale, pull belly to spine as we pull rib cage and pelvis just a little bit closer together, which is going to help bring you into this rounded position a little bit more. Making sure that all the weight is in that elevated hip. And just continue to breathe here. We're going to do 1 minute on each side. So these back expansion breathing drills are really beneficial, especially during pregnancy and the postpartum, because we tend to favor more extension or arching in our back, which can put a lot of pressure down onto the pelvic floor. It can also increase tension to the back half of the pelvic floor. And so sometimes we have symptoms of prolapse because our pelvic floor is tight or there's tension within it. So these movements can be really beneficial to releasing some of that tension. Let's go ahead and switch to the other side. So you're going to shift your weight over towards that elevated hip. So again, you can lift that lower leg off the floor and you would not change your body position because all the weight is in this elevated hip. And so we're shifting the weight over. You should feel more of a stretch kind of in this back glute pocket. And push belly away from the floor. So big inhale into the back. You might feel it a little bit more towards the elevated hip side. And then exhale, pull belly to spine to round a little bit more. So when I exhale, rib cage and pelvis are kind of pulling towards one another, helping to bring me deeper into this rounded position. This is all, again, really targeting that back half of the pelvic floor, helping to improve the sacrum movement, which can help to release some of the symptoms that you may be experiencing from prolapse. So continue to breathe here. Big inhale into the back. And then exhale, pull belly to spine to find a little bit more rounding. Big inhale into the back. Exhale, pull belly to spine. And now we're going to move to a standing position. So you're going to come to your back against the wall, bring the yoga block with you, and you're going to place that between the thighs, just above the knees. And so now I want my back to be fairly flat against the wall. And so you may need to step your feet like a foot to 18 inches away. And then you're going to reach forward to find a little bit of rounding in your back, kind of bringing your shoulder blades off the wall. And then big inhale here to feel that low back, that rib cage area kind of push into the wall. And then exhale, squeeze that yoga block as you pull belly to spine. So find that slight rounding in your lower back. If you want, you can also point the toes in a little bit more, or your feet can be parallel depending on what feels most comfortable for you. So big inhale into that low back. Exhale, kind of squeeze. Round a little bit more. And again, this is bringing us out of that extended position that a lot of us favor during pregnancy and the postpartum to help release some tension towards that back half of the pelvic floor, where a lot of us tend to have a little bit more tension going on. So big inhale into the back, exhale to release, or pull belly to spine. So this is a very active position. We've gone from supine to all fours, now to standing. So now let's go ahead and move on to our workout. We're going to do 3 rounds of box squats, lateral hip shifts, and that banded archer row. So go ahead and grab your elevated surface, any weights that you want to use, and then make sure your band is all set up. For round number 1, we're going to start with that box squat. So we have our elevated surface that we're going to be squatting down to. If you are feeling a little bit more symptomatic, go ahead and grab a Pilates ball or soft object to place between your thighs, but you do have the option to hold on to a weight as well. So active in the upper body, inhale, breathe into your back, and then begin to lower down towards your elevated surface. Keep weight in the feet, and then exhale, lift up in the pelvic floor as you stand out, and then repeat this breathing cycle as you move up and down. So we're gonna inhale as we lower, exhale, lift up in the pelvic floor as you come up. And it can be a very audible exhale as well. So the more demand that we have going on, the stronger that we want our exhalations to be. So we have inhale, feeling that expansion in the rib cage. So we're not inhaling straight down into the pelvic floor. We shouldn't feel like a ton of pressure down into the pelvic floor. But then exhale to think lift up in the pelvic floor, which is going to help to counter that increase in pressure from that exertion. So about 10 more seconds here. Inhales to lower. Exhale, think lift up in the pelvic floor to stand up. Now we're going to move on to the lateral hip shift. You can do this with or without weight. So for the first round, if you want to do without weight, feel free, but you can hold a weight as well. We're going to start by hinging forward at the hips. So we're about like a 45-degree angle with our torso to the floor. And you're going to hold the weight in one hand and shift towards the opposite foot. So feet are parallel towards one another, and then you're going to shift to the other leg. So just alternating between the shift. You can pair it with your breathing as well, where we inhale and then exhale to shift. And so same thing, I'm thinking big inhale into the back. Exhale, think lift up in the pelvic floor. And this is a really great exercise because it helps to strengthen the inner thigh musculature in addition to some mobility work as well. So now let's move on to the third exercise, and we're going to do 3 rounds. So if you're feeling a little bit lost in the first movements, know that we are going to come back to it. So for the first movement, we're going to do this archer row. Your right foot's going to step back and you're holding the band in your right hand. So exhale to row that band back, shift the weight into that right leg, and then inhale to reach forward. So this is a hip shifted movement that's helping to move the pelvis, helping to increase strength within the pelvic floor, while also releasing tension within it as well. And so we're keeping most of the weight in that right leg that we're shifting our weight into. And so we're kind of rowing to that same side. In addition, the upper body is rotating with the hips as well. So now we're going to switch sides. So now left leg is back, holding the band in your left hand. And so we're going to be shifting our weight into that left hip. And again, torso is going to be rotating as the hips are rotating as well. And we're going to find more of that stretch in that left hip pocket now. So exhale to row that band back, shift the weight into that left leg, inhale to reach forward. So exhales to row back, inhales to reach forward. As you're doing this, there's lots of weight in that left big toe. And you should be feeling more of that shifting sensation in that left hip when you row back. Similar to the warm-up when we did the hip shifted breathing drill, you should feel more of that stretch in that glute as you rotate back. So now let's move into round number 2, back to our box squats. So grabbing onto your weight, or again, put that soft object between your legs. You don't have to use a weight if you don't want to. Having some tension in the upper body so we're not sagging here. Inhale, lower down to the box. Exhale to think lift up in that pelvic floor as you stand up. And so the inhale is just as important as the exhalation in this movement. We want to find that expansion, that eccentric loading of the core, but we want to focus it to the rib cage, not down into the pelvic floor, not out into the belly. And then exhale, think lift up to help counter that pressure. The way that we manage pressure during our exercises is really what is going to help us make workouts prolapse safe. And so we really need to be very mindful of how we are breathing and that we're not bearing down with the exhalation, we're exhaling down, because that could cause more issues with prolapse. So inhales to lower when we move with gravity, exhales to lift up in the pelvic floor, we're moving against gravity or against the resistance. Now let's move on to that lateral hip shift. So again, weight is in front of you. We're going to lean forward at that 45-degree angle, and we're going to shift from leg to leg. So feet are going to be parallel towards one another, just a little bit wider than hip distance. So it's not a very big separation at all. So holding the weight in one hand, you're going to shift your weight towards the opposite leg and then alternate to the opposite side. So as you shift the hip over, the knee is staying stacked over that ankle, and we're straightening in the opposite leg. And when we're shifting with the weight, we're rotating in the upper body as well. So you're kind of reaching for the floor with that weight to add in that upper body rotation, because your rib cage position plays a big role in the pelvis and how the pelvic floor can function. Let's move on to the final movement of the round, which is going to be that archer row. So grabbing onto the band with the right hand, right foot is going to step back. So that right foot is the one that we're shifting our weight into. And then again, we want to think about the upper body rotation as well. So with the left hand, you can reach forward. So inhales to reach forward, and then exhales to row that band back as you reach forward with the opposite hand. So if you think about, there's two walls on each side of you that are parallel. You're rotating towards one wall, and then you rotate towards the other wall. So exhale, row that band back, shift your weight into that right hip, lots of weight in that right big toe, and then inhale to reach forward. Really thinking about that breathing pattern as well. So now we're going to switch sides, holding the band in the left hand now. Left foot steps back, and we're going to find that same hip shift on the left side. Same thing, also rotating in the upper body as well. Exhale, go ahead and row that band back as you shift your weight into that left big toe, and then inhale to reach forward. Same thing, we want the rotation in the upper body to be happening at the same time, because rib cage position can influence how we can position our pelvis, which impacts our pelvic floor function. So sometimes some of the symptoms that we may be experiencing from prolapse are related to immobility of the spine in the rib cage or the thoracic area. Let's finish up with our final round, back to those box squats. So grabbing onto your weight if you're using it, or you can have that ball in between your thighs. The ball between your thighs can help to increase adductor activation or inner thigh muscles, which can help support the pelvic floor a little bit more to help with symptoms if you're experiencing them. So inhale to lower down, and then exhale to lift up. Inhales are down again. Breathe into the rib cage, not straight down into the pelvic floor. And then exhale, think lift up in the pelvic floor, particularly the front half, which tends to have a little bit more length for a lot of us as you kind of pull belly to spine. So managing pressure or how we breathe and coordinating that to our movement is going to help to enhance our stability, to enhance our performance, and also to help decrease any symptoms that you may be experiencing from things related to pressure management. So it can help with hernias, with that diastasis, with prolapse. So we want to inhale with gravity, or when we're lowering with resistance, usually the easier part of the motion or the slower part. And then exhale when we're moving against gravity, against the resistance, typically the harder part of the movement. The reason being is we have more muscular activation happening in the concentric portion, and we want to counter that with that muscular activation. Moving on to that lateral hip shift. So again, we're going to lean forward about that 45-degree angle. Feet are just a little bit wider than hip distance. Feet are parallel towards one another as well. And we're going to shift our weight from side to side, moving that same hip shifted sensation in each glute. So reaching towards one leg and then towards the other. We're kind of alternating between bending more in one knee and straightening in the opposite leg. Adding in that upper body rotation as well, because again, rib cage position influences pelvic position, which can impact pelvic floor function. So as you shift, you should feel more of that stretch in that hip pocket of the leg you're rotating towards. Now let's finish up the workout portion with that archer row. So grabbing onto your band, we'll start with the right side. So band is in the right hand, right foot steps back, and we're really thinking tons of weight in that right foot. This is the foot that we're putting all the weight into. So if you're having a hard time getting into that right foot, shorten the stance a little bit. Exhale, row back as you reach forward with the left. Inhale to come forward. So we're rowing back, rotating in the upper body. So we're just kind of like twisting the spine from side to side. If you think about that right leg being like a pole, your pelvis and the rest of your body is just kind of this bowl that is shifting on top of it. So exhale, lots of weight in that right foot. Inhale to come forward. Let's go ahead and switch to the opposite side. So now weight is primarily in that left foot, holding the band in that left hand. We'll exhale to row back and inhale to reach forward. Again, finding that rotation in the upper body. Exhale to row that band back, shift the weight into that left big toe. Inhale to reach forward. And so when we're shifting back into that hip, we're stretching the posterior pelvic floor. And then when we're reaching forward, we're shortening it. So this is a pelvic floor strengthening exercise. It's a hip and pelvic mobility exercise. It's also an upper body movement. And so there's a lot going on to make this full body movement help to support your pelvic floor, to support any sort of symptoms you may be experiencing with prolapse. So that concludes the strength portion of the workout. Let's go ahead and move to the floor. So do some mobility movements to help release tension in the inner thigh musculature, to help support any symptoms that you may be experiencing from prolapse. So we'll start the mobility cool down with an adductor rock back. So you're going to straighten one leg out to the side, and you're going to feel this primarily in the inner thigh of that straight leg, and then bring your hands down to the floor. We're going to be here for 1 minute, and then we'll switch to the other side. So we're going to start by shifting our weight back towards the heel. You should feel more of a stretch in that inner thigh. And then your straight leg foot can either be flat on the floor or you can come up onto the heel, depending on what feels better for you. And then take your time during this movement. So we're just going to rock forward and backwards. There's no rush to do as many reps as possible. Just kind of play around with what feels good for you. So we're shifting back, feeling that stretch in that inner thigh, and then coming forward. If you want to add a little bit of rotation for the upper body, the arm towards the leg that is straight, you can drop down to the elbow, and this is going to rotate you away from that straight leg to help bring you a little bit deeper into it. And so you'll just come forward to where chest is parallel to the floor, and then you'll drop down to that same side elbow. In about 5 seconds, we'll switch to the opposite side. So go ahead and switch. So straighten in the other leg. Same thing. You can either be flat on that foot or you can come up onto the heel. So begin to shift back and then come forward, just rocking back and forth. Pausing at any points that you feel like there's a little bit more tension, that you want to spend a little bit more time on. Again, we're not trying to move through as many reps as possible. We're just trying to move through what feels good for us. Sometimes the inner thighs being on the tighter side, especially if it's a little bit uneven, can contribute towards some of the prolapse symptoms that we feel. So we'll address that with this adductor rock back, and then we're going to finish up with some more hip shifts with some pelvic tilts to also help with that spinal mobility. So go ahead and grab onto your yoga block, and we're going to do that all fours hip shift again. So you're going to place one knee onto the yoga block, and then you're going to shift your weight towards that elevated knee so that you can lift the lower leg without changing your body position at all. But keep both knees down onto a surface. From here, we're going to think exhale, pull belly to spine to round in the back, and then inhale to drop belly down to the floor. So we're going to move through some cat-cows. As you do this, we want to think about the core activation being what rounds you in your back. So we're exhaling, rib cage and pelvis move closer together, not the clenching of our glute or the activation of the hamstring. So we want the core to be what is pulling us into that rounded position. Sometimes the reason that we have prolapse symptoms is we're clenching in our pelvic floor within our glute. And so we need other muscles to start working to help us find these different pelvic positions. So exhale to round, and then inhale to drop belly to the floor. We've got about 15 more seconds on this side, and then we'll set up into the other side to finish up the mobility for today's workout. So inhales to arch, looking forward. Exhale, engage the core to round in the back. Let's go ahead and switch sides. So you're going to bring that yoga block underneath the opposite knee now. And then shift your weight over towards that elevated hip. So you should feel more of a stretch in like that glute area of the elevated hip. When we're in this position, we want both knees to be on some sort of surface though, so we're not elevating anything. So begin to inhale to drop belly to the floor, and then exhale to round in the back again, using that core engagement. So the exhale is pulling belly to spine, which pulls rib cage and pelvis closer together, which is bringing us into that rounded position. So this is helping to release that tension in the glutes within that back half of the pelvic floor, improving spinal mobility. These are all things that can really help you manage symptoms of prolapse that you're experiencing. Because sometimes we just get stuck in these positions It's really easy to get stuck in that extended position, holding baby, letting belly lead the way during pregnancy. And so finding different positions and improving spinal mobility can be really beneficial to relieving symptoms of prolapse that you may be experiencing. Inhales to drop the belly to the floor, and then exhale around, pull belly to spine. And that concludes our prolapse-friendly workout. The key things that we were focusing on in this workout was learning how to move our breath to the movements that we were doing. So inhaling as you were lowering, exhaling as you were coming up, in addition to different movements that were improving pelvic and hip mobility, plus thoracic and ribcage positioning, because we're a kinetic chain, everything is connected to one another. When it comes to prolapse, we want to get off the floor. We can't stay on the floor doing clamshells and glute bridges and then expect improvement when we stand up and live our life upright. And so it's important that we learn how to integrate this stuff as we are supporting our healing in the postpartum and as we navigate movement during pregnancy. If you want more support throughout your pregnancy or your postpartum and you're looking for those prolapse-friendly workouts, definitely check out our online fitness programs. Again, the online fitness programs come with an education course to teach you how to do the movements, because it's not just do these lists of exercises and it'll help with your symptoms. How you do those movements is really important, and that's why we incorporate an education course with all of our fitness programs. You can check out our fitness programs on our website at MamasteFit.com, and again, use code YouTube10 to get 10% off any of our online programs, and then you can bundle them to save a little bit more.